All right, we can go ahead and start over.
Okay. Sorry, we'll just start over. We didn't realize you couldn't hear us.
Sorry about that, guys.
We're doing shaken baby syndrome. I'm Diane.
So I'm Sam. So we're student nurses from the UT Health Science Center. And today we're talking about shaken baby syndrome. And hopefully y'all can hear us now. So let's get started. So first off, we're going to go over what shaken baby syndrome is. It's defined as a serious brain injury that occurs by violently or forcefully shaking your baby. This can occur by either your caregiver or a parent severely shaking the baby due to frustration or anger. And this can lead to permanent damage and even potentially death.
So next, we're going to be talking about how often it happens, who does it, and when it happens. It's really hard to determine how often babies are affected by it because of underreporting. Shaken baby syndrome often happens because children are being abused or neglected. And so because of that, if a child is suffering from symptoms of shaken baby syndrome, then their caregivers don't feel like coming forward or are less likely to come forward because they don't want to get in trouble. It's also difficult to diagnose sometimes because of the way it presents. And so those are two factors that can affect how often it's reported or how it's reported. Experts can still estimate about how many children are affected by it, which in this case, it's 1,000 to 1,500 infants per year. And the CDC reports that 2,000 children die from abuse or neglect each year. 10 to 12% of those cases are said to be caused by shaken baby syndrome. So that's about 200 children per year that are dying because of this. So most children are at risk within the first year of life, but this risk is there until about the first 5 years of life. So the two main reasons why they're more likely to experience this within the first year of life is because of how much their nervous system, particularly their brain, is developing within that first year of life. It's developing at the quickest rate it's ever going to develop at in their life. And so that's why if you injure it at that stage, when it's developing so quickly, you can have severe complications or severe consequences because of that. Another thing to consider is it's a lot easier to pick up a 1-year-old or an infant and to shake them than it is a 5-year-old. And so just their size and the way that they're physiologically made at that point in time in their life makes it a lot easier for them to be susceptible to this. So shaken baby syndrome is also comparable to an adult getting into repetitive car accidents. So what that means is, if you get into a car accident, you experience that whiplash. You're going 30, 40 miles an hour and then you hit a brick wall. Your head's going to go forward and then it's going to come back and it's going to hit the seat behind you, right? The same thing is happening with shaken baby syndrome, but it's more repetitive because you're shaking the baby. So their head's going back and forth, like this. Whereas when you get into the car accident, it kind of happens, once or twice. So that's why it's repetitive car accidents instead of just the one. So shaken baby syndrome can not result in any way from playing with a child. You can bounce the child on your leg. You can toss them in the air. We don't necessarily recommend that either, but those will result in different injuries than shaken baby syndrome. Shaken baby syndrome results in specific injuries that are very specific to that action that you're doing. The caregivers that are most likely to cause shaken baby syndrome are men. And one thing that I do want to point out is that doesn't mean that men are less equipped to take care of children at all in any way. It just means that because of the way they've been socialized or because of maybe some other social factors, they are more inclined to maybe get more frustrated with a kid, or they're maybe less able to be receptive to what a child's trying to tell them when they're crying. And men are just as capable as women to be able to take care of children. And they're also just as capable as women to be able to learn how to be more perceptive to children, how to respond to them better as well.
All right, guys. So now we're going to talk about what it looks like. So with the name implying, it's just violently or forcefully shaking your baby back and forth. But this is much more dangerous for a baby as they have softer brains and weaker neck muscles and larger heads, which in combination can result in damages to your infant. With their having a softer brain, when you're shaking your baby violently or forcefully, it could cause tears in the brain tissue, blood vessels, and nerves. And with them having a weak neck, they really can't take the shaking. So that can really harm their neck as well. And with them having a large, heavy head and a weak neck, it really makes it really difficult for the brain to withstand the type of pressure that they're experiencing.
So some of the consequences of shaking a baby. Of course, as Sam went over, he went over the different physiological things that happen within the child's head when you shake it, but it can cause, things like brain hemorrhage. And hemorrhage just means that there's an excessive amount of blood that is coming out of a certain area that it shouldn't be. So if your brain is hemorrhaging and if it's bleeding too much, that blood's not getting into your brain, which means that you can be losing oxygen and that certain areas of the brain can potentially start dying off, which is why it's really significant. That can cause long-term development problems. It can cause intellectual disabilities, and it can even cause death if it's really bad. So another thing to consider is the injury to the spinal cord. So your spinal cord connects your brain to your body. And I have a model here. Let's see. So as you can see, this is the baby's head. The spinal cord connects right here at the back of the head right there. And so if the head's coming back like this at a really hard, with a lot of velocity or a lot of force, that can compress the spinal cord and it could potentially even sever the spinal cord, which is going to have, once again, long-term developmental problems associated with it, because your brain needs to tell your spinal cord your brain tells your spinal cord to tell your lungs to breathe. It tells your heart to beat. It tells your body to move. It tells your body to do essentially everything, including the things that you need to do to survive and to live. And so if that gets injured, obviously, as I've mentioned before, it's really significant. Another thing that can happen is retinal hemorrhage, which is just bleeding in your eye, or retinal detachment. And so retinal detachment is, so you have the back of your eye here, and then you have your retina, which is just a layer covering the back of your eye. Retinal detachment means that this comes off. It's really, really painful, and it can have long-term complications for that child's vision later on. Another thing that I wanted to demonstrate with this child is kind of how shaken baby syndrome can escalate. So let's see if I can do this. Should be crying soon. There we go. So as you can see, this baby's crying and crying, and it can get really, really frustrating listening to it. And so you might start shaking it here, and you see those lights that are coming on? Those are the areas that are experiencing brain damage. And so if you shake it harder, it stops crying. And when that child stops crying, essentially it means that there's so much brain damage that your child might die. So that's not a good thing that we want to see either.
All right, guys, so we've gone over what shaken baby syndrome is, what causes it, what can potentially happen because of it. So now the next step that we need to look at is the signs and symptoms that may indicate that your baby has experienced shaken baby syndrome. So now when we're looking at this list, don't take just one of them and start to think that that's because of shaken baby syndrome. Some of these, like drowsiness, altered level of consciousness, vomiting, that can be for a variety of reasons. So we have to look at this as a whole. And if you see multiple of these symptoms, that's when you should start to consider getting it checked on and seeing if your infant has shaken baby syndrome. So going through the list, guys, we have altered level of consciousness. And as the mother, as the caretaker, you know your baby the best, so you know what their level of consciousness is generally. So if you see any alterations in that, please make sure to address that and see what the cause of that is. Drowsiness accompanied by irritability. Now that is pretty common for most infants to experience, and even for us adults to experience. So that is not necessarily a sign that you should look at and assume that it's shaken baby syndrome. Comas, of course, are major things that would be a sign of shaken baby syndrome. Convulsions or seizures, definitely with both those two. If anything related to that happens, get to the hospital as quick as you can. Dilated pupils that do not respond to light, a decreased appetite from their norm, vomiting, and breathing abnormalities. Those can all be things. In a rib fracture, if your baby is showing that they have pain in their abdomen area, it might be a sign of a rib fracture. And then also, as the picture, you can see the picture with the baby with his neck in different positions. Your baby can also show from the outside that they have an irregularly in their neck positioning. This can be due to the shaking in the weak neck, and this can cause your infant to have torn muscles or ligaments and just in general pain in your neck.
So some common problems associated with shaken baby syndrome. The most common one is prolonged crying of a baby and then the parent's inability to alleviate it, which then causes a lot of frustration, maybe even some anger. So an important thing to note at this point is that no parent really has a kid to abuse it. That's not why parents have children. And so a lot of times when this happens, you also have to look at the risk factors that are involved in this. So if you have a child that cries a lot and won't stop crying, how is that going to affect parents and their parenting? It's probably going to prevent them from getting a lot of sleep, which then is going to make them, more likely to snap. It's going to make them more irritable. It's going to make them more frustrated because they don't have the rest that they need. Another thing to consider is, women who maybe have postpartum depression that can impair the attachment that they have with their child and make them less responsive to their children. And so that's another factor to consider as well. The last one is if you have a support system to help you with your child or help raise your child, sometimes that can really, really help prevent shaken baby syndrome, just because you can, give your child to a trusted caregiver for 4 hours and take a 4-hour nap. That'll make such a significant difference in your own mood and ability to respond to your child and decrease the chance of you getting to that level of just frustration and anger where you don't feel like you can get out and you just get so frustrated you shake your child. So some things that you can also try to calm your child is you can see if you can feed them. Maybe they're hungry. You can swaddle them. Maybe they just need some attention, some love. You can play soothing music, and you can withdraw attention from the baby. And what we mean by that is you just put the child down and you walk away and you take a break for yourself, because we'd rather you leave the child alone when it's crying than you shake it and deal with, obviously, the complications that we've been talking about. So.
Yeah, guys, so kind of piggybacking off of what Diane said, we're going to go over next is preventative strategies to not allow the shaken baby syndrome to happen in the first place. And all these strategies actually come back on to you as the caregiver, as the parent, because really we as the caregivers are the ones who are responsible for keeping the safety of our infant. The first strategy, and this sounds so simple, is just keep your composure. That is the most crucial thing you can do in order to prevent shaken baby syndrome from occurring. And everybody has their own different method for keeping their composure. And just the best thing to do is to go out and try different methods and see which one works for you. But some of the ones that we recommend is just use controlled breathing, meditation, give yourself a positive pep talk. Count to 10, just get your mind distracted from the situation that's going on at hand, and just keep your composure, because at the end of the day, that's crucial to preventing this from occurring. Another thing is to think outside the box when you're trying to soothe your infant. Each infant's different, and you know your infant best, and just find what works for your infant. It can be singing, it can be dancing, funny facial expressions, it can be rocking them in a chair, whatever it can be, just to get them to relax, to stop crying, and to therefore help you alleviate your frustrations. Figure out what that is and try to find out what you can do to help soothe your infant. What Diane talked about in the last slide and what's crucial is just getting rest. You can't take care of somebody else if you can't take care of yourself in the first place. So make sure you get plenty of rest, you get adequate sleep. Make sure or try to find somebody in your life that you can trust to take care of your baby and just give you some rest when you need to. And just make sure you get a lot of rest. And the last one is walk away when you need to. Hand your baby off to somebody else that you trust, or leave your baby in the crib and just walk away, because instead of shaking your baby out of frustration, just let your baby cry would be a way healthier solution, and will help your baby out in the long term.
So kind of also, again, piggybacking off of what Sam said, alternatives to shaking the baby. Initially, the first thing you kind of want to check for when your child's crying is, are they hungry? How long has it been since they ate? Maybe they are hungry. How long has it been since they ate? Maybe they, have a soiled diaper and I need to change it. Do they have 10 blankets on them, or do they have no blankets on them? Do they want to move? Maybe they don't. Those are kind of just comfort measures that you're checking for with your child to see if maybe they're just uncomfortable. And by addressing these needs, a lot of times babies will stop being as irritable or fussy just because their needs have been met again. And once you have a child, usually the longer you have that child, you guys build this relationship and you get into this rhythm of, oh, that's their hungry cry. Oh, that's their diaper cry. You build this relationship and it becomes a lot easier to kind of figure out what your child needs. So if those first ones don't work, then you can continue on and see if maybe they just need some, cuddles. Maybe they need a good snuggle and they'll be okay. So you can hold your child, you can swaddle it, you can rock it, you can coo to it, you can, if you can't actually hold the child, you can put it in an infant swing that swings it back and forth by itself. You can try using white noise or soothing sounds to help calm the baby down as well, because maybe they're just emotionally distressed or they're stressed out by something, and doing those will help decrease their stress level. And lastly, crying is very commonly associated with gastrointestinal upset, which is essentially just tummy problems. And so if that's the case, you can use simethicone, and you can give that to them after they're done feeding to decrease the gas pains that they have. So everyone, including us, we have little gas bubbles in our GI system. And so if they get too large, or if there are too many, that can cause gas pain. And so taking this drug will help decrease the gas pain that your child might be feeling and the uncomfort they might be feeling with it as well. Another thing that you can do is you can turn your child face down. So like this dude, turn it face down on your knee, on your leg, usually your thigh, and you can just pat their back, and that'll help them burp. And by doing that, that'll also help get rid of any excess gas that they might have. So, wrong one.
Yeah, all right, guys. Well, we did have a few videos we were going to play, but unfortunately they weren't working at the moment. So that does conclude our presentation for the day. If you have any questions, feel free to ask them. We'll be happy to help you out.
Okay.
Right, bye.
Okay, bye. Thank you.